Hello, everyone, and welcome. We will get started here in just a moment. All right, as we have other folks joining us, I would just like to say welcome to 2023 and also welcome to the first PQA Quality Forum Webinar of the year. I'm Amanda Ryan, Director of Education here at PQA, and today we are excited to introduce you to the newly released second edition of the PQA Social Determinants of Health Resource Guide. We will also feature two initiatives that are contained within the guide that are new to this second edition. We will get into all of that here in just a couple of minutes, but first I would like to walk you through our housekeeping items. First, as usual, please submit questions to us throughout the presentation today. You can use the Q&A feature that you will find at the bottom of your Zoom screen, and we will collect those during the presentations and answer as many as we can during the Q&A portion at the end of today's webinar. Also, the webinar recording and the slide deck will be made available to PQA members within a week following the webinar today, and you'll be able to find that in the Member Resources Library on the PQA website. Additionally, we will be posting the recording on PQA's YouTube channel. And then finally, I would like to encourage you, please, to complete the quick 1-minute survey that will launch as you exit the webinar today. We do always appreciate your feedback and utilize that to inform our future webinars and educational programming. With that, it is now my pleasure to introduce you to today's panel of speakers. First, we have with us Jacinda Abdul-Mutakabbir. She is also known as JAM, and she is an assistant professor of clinical pharmacy at the University of California, San Diego. Also with us is Dana Erf Fortman, who leads Walgreens Health Equity Team, where she is responsible for the development of the Enterprise Health Equity Strategy and also Walgreens Health Equity efforts. Next with us, we have Latasha Guy, who is a pharmacist at Walgreens. She supports the health equity team, where she manages the health equity stores and also helps develop and implement programs to improve outcomes in underserved communities. And then finally, we have Jasmine Perry, who is one of PQA's executive fellows, and Jasmine was instrumental in the development of the second edition of the SDOH resource guide that we will tell you about today. I'd like to thank all four of you for joining us today. And with that, I will turn the floor over to Jasmine.
All righty. Thank you, Amanda, so much for the introduction. As mentioned, I'm Jasmine Perry, one of the executive fellows here at PQA. And I'm incredibly excited and honored to introduce you all to the second edition of the SDOH resource guide, because during my time as a fellow, I've worked extensively on this resource. So the second edition does document some innovative real-world SDOH services, but ultimately these services are incredibly promising for improving medication use, but beyond that, improving quality and safety. So the guide can be accessed on our website, but at the end of this presentation, we'll discuss specifics about how you can access this resource. So PQA, we are excited to continue to do this work to disseminate information about innovative SDOH services and interventions. But the true nature of this guide, the thing that makes it unique is that it truly talks about pharmacies and pharmacists' impact on SDOH. So pharmacists are uniquely positioned to have contact with community members because we're at the forefront in different communities, but ultimately pharmacies and pharmacists can have true impact. So this guide is a centralized source of ideas, examples of SDOH services, but ultimately we want to highlight that pharmacies and pharmacists are truly doing the work. So let's get into some logistics about the resource guide. So ultimately the second edition details 32 initiatives. So it is expanded from the first resource guide that featured 20. And we're excited to report that that's above a 50% increase in the number of initiatives. Beyond that, we've taken 9 of the initiatives that were featured in 2020 and updated those for you guys. So the second edition does focus on 7 key focus areas, those of which are listed on the screen, but some examples are cost of medications, cultural or literacy barriers, food security, social isolation, transportation. So all these things are covered throughout the resource guide. And it's important to note that these, or some of these areas were highlighted by our membership at the 2020 Leadership Summit as areas where pharmacists can truly have impact. So during this, we're also going to talk about screening, referral, and interventions, but ultimately our goal was to highlight initiatives that started during the pandemic, but also continue to have impact today beyond COVID-19. And as we're identifying examples, most of these initiatives have some overlap, and that's because, as you would expect, a number of patients who experience SDOH-related barriers to care, they often share multiple social risk factors. So our goal was to feature initiatives that, of course, screen for SDOH factors, but we also wanted to move beyond that to focus on interventions that focus on referral and intervention. So I'm happy to report that 20 of the initiatives focus on screening, 16 focus on referral, and 22 focus on interventions. For the SDOH areas addressed, we briefly mentioned the 7 core focus areas earlier in the presentation, but 27 of these focused on cultural or literacy barriers, followed closely by transportation, with 22 initiatives being represented. Beyond that, decent, safe, affordable housing represented the fewest number of initiatives with 12, but it's important to note that as a result of the COVID-19 pandemic, we also wanted to highlight social isolation. So 13 initiatives did have impact on social isolation. In terms of setting, earlier we discussed how the guide focuses on pharmacies and pharmacists. So with that, most of the initiatives happen within the community pharmacy space or community pharmacy setting, but non-traditional healthcare came in at a close second. So non-traditional healthcare or other during the resource guide or within the resource guide focuses on things like telehealth, telepharmacy, churches, in-home interventions, and outreach clinics across multiple sites. For scale, most of these initiatives did focus on local efforts, and it's really, really important to note that a number of these local efforts were in partnership with community-based organizations, and those partnerships led to true impact in communities across the U.S. You can also see here on the screen that national, rural, regional, and state was represented in the resource as well. So going into some specifics about the initiatives that were included. So as you're going through the resource guide, you will see that all the initiatives have a similar format, and it starts out with some background information that truly dives into the core of the initiatives. So it talks about the different organizations involved, SDOH areas addressed, setting, location, scale, population, and keywords. But the brief description and the key takeaways are areas where you can truly grasp quickly what the initiatives aim to do and some of the results from these initiatives. You can also see that all the initiatives feature some details about the interventions, but beyond that, the outcomes. And for some of the initiatives that were included in 2020, we also focused on lessons learned since implementation to see the impact that these organizations or community members have had over time. So if you are interested in a specific characteristic, SDOH area address, or essentially anything that we've talked about today, if you want to dive more in depth into these specific characteristics, you can visit our appendix. And this essentially includes different categorizations of each initiative. So you're able to go in and choose or see which initiatives you're focused on or interested in. So with that, thank you guys for your attention. I am so excited to pass things over to Dr. Jan.
Hi, everyone. I'm so happy to be here with you all. And I want to talk a little bit about making health equity a reality, which really describes the interventions that Jasmine previously talked about. And it was in San Bernardino where we enacted this intervention. So just putting everything into perspective, we know that COVID-19 has disproportionately affected racially and ethnically minoritized communities. We know this to be true. We've seen it to be fact throughout several publications, several reports. And we know that the COVID-19 vaccines, since approved in late 2021, have been able to change this statistic. Nonetheless, we still see that there's just been lower uptake regarding the vaccines in racially and ethnically minoritized groups. And this lower uptake can be attributed to distrust and mistrust. However, I would argue that access and limitations thereon are what really prohibits these vaccines. So we end up in this place of, well, what does vaccine equity look like? And I really like to use this photograph on the left to go ahead and describe this. This is a really great picture. I really love it, from the Robert Wood Johnson Foundation. But they talk about just the differences between equality and then equity. And I think about this from a health and vaccine perspective. So when we look at that top part of that picture, we can see so many individuals, well, all these individuals have this bike, right? So they have this bike. We see the person sitting in the wheelchair with the bike sitting next to them. We see the other individual next to them kind of hunched over on this bike. And I think about this in terms of vaccines. So could everybody receive a vaccine? Absolutely, right? We hear the Biden administration talk all the time. We have vaccines, but can they receive a vaccine easily? Are the vaccines being placed in the community? Are we eliminating those barriers to ensure optimal vaccination access? So let's look down to equity. So that's the difference between equity and equality. Equity is actually removing limitations and making sure that these needs are fitted to those individuals so that they can have maximum usability. So I want to really lead us into my part where I describe making these vaccines usable. So giving the individuals of racially and ethnically minoritized groups maximum usability. So we started these clinics in San Bernardino County. So San Bernardino County is the 5th largest county in California. It's bigger than some small countries. So at the time in which we started this work, about 17 million folks have been vaccinated against COVID-19. Today, we have over 85 billion in California, actually one of the largest vaccine uptakes in the United States. However, more than 70% of Black individuals, specifically in San Bernardino, remain unvaccinated. So at the start of the vaccination rollout and prior to January 2nd, 2023, I was faculty at Loma Linda. So Loma Linda University is located in San Bernardino County in California, and held the largest mass vaccination clinic sites in the county, the largest mass vaccination clinics, meaning we were vaccinating somewhere around 1,000 to 1,900 individuals at the height of the pandemic every single day. However, we did notice that we did not have as much uptake for Black individuals. So we only had about 3% of our vaccinees that were Black, and we knew that Black individuals were being the most impacted, or disproportionately impacted anyway, by the virus. So we knew that very concentrated efforts would be very important throughout this community. So therefore, we went ahead and we developed a 3-tiered approach for creating equitable COVID-19 vaccination access. So these tiers, they were very pointed, but they included very integral things that we have continued to mirror throughout our process. So first and foremost, we had the engagement of Black faith leaders, because at the end of the day, we had to acknowledge the fact that while we want to serve the community, we don't really know the community. So prior to me being in California in 2020, I was born and raised in Detroit, Michigan. So I knew nothing about San Bernardino County. So it was really important to get into the community, but also to put the community leaders at the forefront of this work. And then after this, we did COVID-19 vaccination education. So that was a place where I was able to use my expertise as an infectious diseases professional to really translate the clinical information, but to translate it in a way where I really focused on individuals of minoritized communities, because I know these individuals were impacted, but nonetheless, to increase uptake, I knew it was important to increase trust. So I had to make sure I went through those clinical trials and showed the health system is one that you should indeed trust. And then low barrier community vaccination clinics. So we talked about the mistrust and distrust, but like I said, I would argue that the limitations and barriers present to healthcare are really what is prohibiting that uptake. So it was very important for us to go into the community and to put the vaccines right there so that individuals could receive them. So with engaging the Black faith leaders, we really leverage relationships. Loma Linda is a faith-based institution. So thankfully, we were able to go ahead and have those relationships ever present there. And we worked with the Inland Empire of Concerned African-American Churches, as well as the congregations organized for prophetic engagement. That gave us range and access to about 32 pastors within San Bernardino, as well as Riverside County. So with those 32 pastors, we ended up using different areas and different locations there. We're able to really have reach. And then with the faith leaders, not only did they allow for us to have access to their communities, but they also really helped us create how it is that we wanted to roll out these vaccination community clinics. So they were very important. So after we engaged our faith leaders, we then started to conduct what we call COVID-19 educational town halls. So in these town halls, we made sure to include individuals of racially and ethnically minoritized groups to really just increase the racial concordance there. But more importantly, we knew that it was important to really represent the folks that we would have just in the body and really ingrained within this community effort. So these town halls, when we first started, were led by the university's Vice President for Community Engagement, Dr. Juan Carlos Pelliard. And then actually we began to have the community members or individuals that were affiliated with congregations organized for prophetic engagement to go ahead and lead this conversation. Because once again, it's important that the community is positioned at the forefront of this work. So following that, I have a Black psychologist. She's actually my research partner, my collaborative partner, Dr. Bridget Petit. And she actually talks about the behavioral aspects of why it is that individuals may not want to be vaccinated. So the fears that may be present. She really kind of, we call it, she butters them up so that I can come in with the information. But also we're comprehensive. We make sure that we can turn data around for what it is that we're doing. So Bridget conducts surveys. And in these surveys, she goes and she asks, we do a pre and post survey, and she asks, who would be interested in being vaccinated before we conduct any of this information, before we give you anything here, would you be interested in being vaccinated? We have about 50 to 70% of folks that say yes, they would get vaccinated. Well, thankfully, and we've actually published this information in both the Lancet as well as other journals, we were able to pull that number up to 90%. After we provide this education here to individuals. We usually have about 100 to 200 per town hall. Of course, that's tapered off as we've gone through the pandemic, but we do have a good showing and we are able to go ahead and be effective with the education that we provide. And then finally, we host vaccination clinics right there in the community. But like I said, we really use the community leaders as our governance for who it is that is the most vulnerable, who it is that we should target first. How do we really get into this church? How is it that we communicate with the faith leader there at that church? So the community organization really, really is so important there. But when we think about just the vaccinations, there's a lot of just mistrust there. We are only, I think we celebrated with the 30-year or 50-year celebration from the Tuskegee experiment. So we're not very far removed from history, and more contemporarily, we're not removed from the discrimination and stigmatization that individuals of minoritized groups face. So racial concordance is important. Having someone that is intimately acquainted with your lived experience is important, especially right here in this type of format in the act of providing vaccines. So I go ahead and I participate in every single clinic. I actually precept our students that go ahead and participate in those clinics as well. So when we developed these clinics, equity was really at the forefront, and we wanted to make sure that we just took away all of the barriers that we saw, the barriers that we could reasonably remove. And throughout this process, we have continued to re-examine to see, is there anything else that we could do better? So when it came down to access, well, we put the clinics right there into the community. When it came down to transportation, we tried to put them in more urban locations or places where it would be easier for individuals to reach. When it came down to internet and computer access, guess what? We had paper-based forms with all of the information that we would put into the Epic right there available for the patients to fill out. But also with these paper-based forms, we made sure that they were able to continue to ask questions. So there was no appointment slot to where if they were still a little bit hesitant or still had a bit more questions that they would be likely to miss. No, they could still come and ask questions at the clinic and we would vaccinate them when they were ready. So when I think about this, when I think about the work, I always talk about the fact that it's not just me, it's not just pharmacists pushing this effort. It is it's in health equity is just such a priority and should be a priority for every single branch of service that we can think about. So when we think about pharmacists, when we think about physicians, nurses, dentists, everyone has to be invested in this. And this is one thing that I think the community vaccination clinics really showcase. So first and foremost, our most important stakeholder, I always say, has been our faith leaders. They have been just so integral to this work, and I'm so thankful for them and the trust that they placed in us. And because of this, I continue to position them and to show the buy-in that we have with them. So our faith leaders are actually placed first are placed as authors in our manuscripts. So we have published in the Lancet, we published in other various journals, and our faith leaders are always included on the manuscript. In the Lancet paper, they're actually our 2nd through 4th authors on that paper, because that's just how essential they are. But I think that's an important part of just community efforts. You have to show that same buy-in that the community shows to you. So then we also have pharmacists, medical professionals, physicians, nurses, dentists, community health workers, and so on and so forth. So many people that come together and really make this something that can occur. So with our low barrier clinic workflow, I think it's important that we don't think about equity just from the typical perspective, but we really go right down to how it is that we provide these services. So we use the same format, whether we're indoors and outdoors, but it really comes down to personnel. So when we think about registration, we're ingraining the community throughout all of these processes. We have church personnel and community workers that work in that registration area. We have vaccinators. So our vaccinators are typically our professional students, because it's important that they have these tangible health equity opportunities, right? And then we have a vaccine draw area where we will still have pharmacy students, but then we also ingrain medical students, dentistry students, respiratory therapy students, because it's important that not only the pharmacy students know what health equity should look like, but every single student, but also that they know what collaboration looks like. And then for our checkout, we have community health workers ingrained, as well as a physician or any mid-level practitioner, so pharmacists, advanced practice nurses, and so on for the observation. And then when we talk about just outcomes, it's important, because did it happen if you don't have any outcomes here? So this was published after our first clinic. So we had at the time in which we had gone ahead and did our first clinic, there were about 17,000 individuals that had been vaccinated at our mass vaccination clinic site. However, when we did our clinic site, our first clinic site within the community, we had 420 individuals that were vaccinated. Of that 420, 351 were Black individuals. So we went from 3% in that mass vaccination clinic site to 83.5% in our community clinic. So that necessary overrepresentation of that previously underrepresented group. So very essential here. So when we went back, we continued, we did a 2nd dose vaccination clinic. We had about an 87% return rate for that vaccination effort. We have gone forth to do about 17 additional vaccination efforts following this, just in the Black community. When we include the Black community and then the Hispanic community, we've done likely over 30 vaccination efforts. So we've really been able to be active here in the community. We vaccinated about 3,250 individuals, racially and ethnically minoritized, with the COVID-19 vaccines. So I do want to just harp on just the importance of involving students. One thing that I will say here is just, it's been so great to see my students grow as empathetic future clinicians and providers. It's so important that we teach them just the importance of, one, collaboration, but we also teach them the importance of health equity, but we identify to them what it is that their role can be here. And we've continued to reproduce these clinics. So I talked a lot about the Black community, but we have also gone into the Hispanic Latinx community and done the exact same vaccination effort using the exact same model. And we, in our first vaccination clinic, we vaccinated about 258 individuals. In our 2nd dose clinic, we had about a 98% return rate. So 253 individuals came right back to that site. And I just want to go ahead and just reinforce the importance of making sure that we provide healthcare within these communities. And then finally, when we talk about our future directions of the clinic, at this point, we have transitioned to in-person educational town hall. So we actually have the town hall where we provide information pertaining to the vaccines, as well as available COVID-19 therapies. And then we have a vaccination clinic right afterwards in that same location. I've actually partnered with Congregations Organized for Prophetic Engagement, or COPE. Together, we have formed the COPE Health Equity Collaborative. I'm very excited for our continued work. Our hope is to continue to involve other vaccinations for other vaccine preventable disease states, and to also include HIV rapid testing within that community vaccination clinic setting. So really trying to branch out and hit all areas of disparity. So health inequities are a product of structural and systemic racism, but when we think about the equitable processes that can be developed, they can have positive patient outcomes and positive impacts. However, for us to continue with these types of efforts, we do need to collaborate and really reinforce how important multidisciplinary support is. So I'm going to go ahead and pass it to my colleague, Ms. Dana here, who is with Walgreens. Thank you.
Wonderful. Thank you, Dr. Jam. Really appreciate your insightful learnings and certainly echo your calls to action around the opportunities which partnership and community engagement can offer to addressing health inequities. So we'll go ahead and dive in. Hello, I'm Dana Erf Fortman, and I lead Walgreens Health Equity Strategy team. And I'm joined by Dr. Latasha Guy, who is responsible for our health equity operations execution. And we are thrilled to join today's Quality Forum webinar and to share a spotlight on one of Walgreens' efforts in advancing health equity, and in particular, recognizing and addressing social determinants of health. So let me flip here. So Dr. Jam and Jasmine both provided wonderful context regarding what health equity is and how to think about social determinants of health. And so to start, before we dive into the initiative that we're going to spotlight, I'll share that at Walgreens, we firmly believe that it is imperative that health equity considerations and objectives be infused alongside existing business priorities, because both can and should be addressed in tandem. And really every one of our business lines and teams, from healthcare to pharmacy to retail, all have an opportunity to both recognize and address health disparities to improve community health and really to live to our vision of reimagining localized healthcare for all. So to that end, we're focusing on improving patient outcomes really by centering on 3 health equity pillars of access, partnership, and education. And so when we think about access, leveraging our omni-channel footprint to ensure equitable access to products and services for all. Partnership, reiterating what Dr. Jam noted so eloquently, we recognize that while each organization must prioritize this critical topic, we're all better together. And so it's super important to collaborate and to partner not only across the healthcare ecosystem, but also within our local communities with community-based organizations, faith and affinity-based organizations, government, and patients themselves to increase engagement and broaden our reach and engagement to improve those health outcomes. Today's webinar on the PQA SDOH resource guide is really an incredible example of the opportunity for collaboration and co-opetition in this space for sure. And then finally, education is our last pillar. So recognizing that one of our core strengths is being a trusted advisor and the trusted relationships that we have with our communities and patients, and leveraging that to help optimize patients' healthcare journeys, however it may look, but also in tandem ensuring that we are educating our own team members on what health equity is, it's important, and why it's important, I should say, and how they can help. So if we take that one step further, we are focusing on 4 primary areas as we seek to improve those patient outcomes and really narrow the health equity gap. These 4 are certainly not mutually exclusive and represent multiple programs and services and partnerships, but we feel it's important to highlight each of these given the importance on addressing health disparities. And of course, social determinants of health is front and center and really weaves across the other 3 areas as well, but important for us to recognize on its own. And today, Dr. Guy and I are going to spotlight an example of a program that falls both in the SDOH space as well as medication adherence and chronic care management. So let's dive deeper into delayed medication pickup outreach. So when we think about delayed medication pickup outreach from the health equity lens, our focus here is really to ensure patient adherence to their medication regimen, as well as to address social needs and barriers to care. And at Walgreens, our pharmacy teams conduct delayed medication pickup outreach daily across all of our stores chain-wide through our patient care portal. This outreach occurs by phone and occurs when a patient has a filled script that is ready for them to pick up, but they have not yet come in to pick up that script. And so these conversations really provide a unique opportunity for our pharmacy teams to speak with patients live and better understand the reason for the delay in pickup and what barriers may contribute to that delay in pickup or the potential prescription abandonment, and then offer the patient tools and solutions to address those barriers. And those barriers, as you can imagine, many times do lead back to one or more of the social determinants of health, such as transportation or cost or health literacy, just to name a few. So I'm excited to hand the mic over to Latasha, who will share more details on the delayed pickup program and best practices, which you may be able to consider in your own health equity efforts.
Thank you, Dana. I appreciate that great introduction. And what I would do is take you on a deeper dive into one of the programs that Walgreens have, which is the delayed pickup program to help address social determinants of health and barriers patients may be facing with picking up their medications. Here, I would take you on the patient journey and when a patient refills their prescription. And if that patient refills that prescription and does not pick it up within 9 days, that patient's prescriptions populates in a portal where a pharmacy team member is targeted to inform the patient and call that patient to remind them they have a prescription to pick up. Now, this is, as Dana mentioned, an opportunity for us to really have that conversation with that patient and identify barriers that specific patient may be experiencing and offer targeted, personalized solutions to close that gap in care and improve accessibility to that prescription for that patient. And some things that are critical is that conversation and improving awareness with the patient of the programs and services that are available to them, and making sure the patient can access that prescription. And some of the barriers that we've identified as patient, as Dana mentioned, it may be transportation, understanding why your prescription is important to take every day, being proactive about it. And there may be also cost barriers where we can offer those solutions to care. But the goal is not to recreate the wheel, but to leverage existing programs and services to improve accessibility for those patients. So shortly, I will walk through best practices we have gathered through some of the programs created and how we can leverage those existing programs to help patients. But this is an opportunity for us to truly understand what is preventing patients from picking up their medications on time and remaining adherent to the medication. And to recognize each patient is different and there may be needs, and their needs may and will change at different times, as we have learned during COVID. But we have the ability to empower our team members with coaching and training on how to have that conversation and to make the tools available to the team members to deliver to the right patient at the right time. So with some of the programs that we have learned some of the main barriers that patients have experienced was cost, and that may be due to, the patient can't afford the medication, maybe on a fixed income per se. Transportation, the patient may not be able to get to the pharmacy in time to pick up their prescription, and also patients forgetting their medications. But the most important thing is that we do have existing tools and services available for patients to actually address these barriers patients are experiencing. Like we have delivery offerings to help patients get medications where they don't even have to come to the pharmacy. And also we have digital tools that can help patients remain adherent to medications and ensuring that they have those tools available and actually are aware of what's available to them. So here we're taking a look at, and these are examples of how we are prioritizing health equity at Walgreens as we are spotlighting our program, the delayed pickup medication. And the first program that we created at Walgreens as the health equity team was the Chicago Incubator Program. And this was created in 2020 on the south and west side of Chicago. And we recently expanded the program out west to Texas, Arizona, Nevada, and New Mexico stores. And this is where we really engage team members in the stores in those areas and we coach them on properly having those conversations when they make those delayed pickup calls to really know what barriers patients are experiencing and to offer the solutions. Because if we understand and recognize that if we don't identify the problems, those patients are the ones who frequently have the issues with picking up their medications. And on these, we have coaching and feedback sessions. And with these calls, the team members share best practices and how we can really localize and support their communities. And also the second program we've developed, which is in relation to different forums we have created internally within Walgreens that we are really excited about, is the Health Equity Champions Network. And this program was developed and is comprised of field leaders in our areas who are really passionate about supporting their communities and getting out there and creating partnerships and events that truly support those areas. And they share their best practices and their partnership and how they're executing in their communities. And given that with the partnerships, really sharing how, I know Dr. Jam just talked about the faith leaders and the churches and how they created those partnerships, because we do realize we can't do this alone. And community support is very key in execution of these programs. But here, there's a real opportunity to create that bi-directional feedback and communication from the programs that we are trying to create to provide that localized healthcare, which is our vision. So we know how to truly support those patients. And here, these are some of the best practices and lessons learned from our programs that we created that I just discussed with the incubator programs and Champions Network that we utilize to localize healthcare and include health equity in everything that we're doing. And I will go through these quickly. And one, as we see here, when the team members are executing the calls, and these are some of the things that you can implement in your pharmacies to help your patients. Be mindful of the time of day that you're calling. Know your patients. They could be elderly patients who are available more during the daytime, or they may be those moms who are supporting their children or caregivers, or even those that work and they may be more available at night. The next one is ensuring that we have the correct phone numbers for patients, because as we know, in many underserved communities, phone numbers may change frequently. So it's important that we're doing what I call a phone hygiene. Update the phone number at points of contacts with patients, and ensuring that we have the correct phone number, that maybe when they're dropping off prescriptions and looking at the prescription and look the phone number that are on the prescription, or when the doctor sends electronic prescriptions to the pharmacy. And also we can encourage delivery to remove the transportation barrier. Walgreens does have free 1 to 2 day delivery chain wide. So making sure patients are aware of services that we have that can help them remain adherent to their medication and improve access to prescriptions. And also explaining the why to team members. Why is it important to help patients remain adherent to their medications? The team members execute health equity every day, and they help to ensure patients are adherent to their medications, whether that be finding their insurance, helping them understand their insurance, help them address the cost of medication, the pharmacist, collaborating with the insurance and the doctor to help get a cost-effective medication for that patient, addressing language barriers and letting us know, when their community need a different language for their prescription and anything like that. But understanding health equity is not new, and especially not to Walgreens, and we have been delivering these services for many years in our communities. And also digital services. We know that when patients are digitally engaged, they're more likely to remain adherent to their medication. But we are tasked with bringing together all these great programs and amplifying all the great work and best practices across the organization. And so knowing the status of your prescription is important, and providing that localized healthcare to patients. And we really want to empower our team members to help patients provide solutions and really address and support patients on their healthcare journeys. But I wanted to take a moment to thank PQA for inviting Walgreens and Dana and I to join this conversation, and thank you all for joining this conversation and having Walgreens share how we support our patients and communities. Now I'll turn it back over to Amanda.
All right, wonderful. Thank you so much, Latasha. Thanks to all of our panelists for joining us today. We are going to have a Q&A portion here in just a moment. We've got a couple of questions that have already come in, but I'd like to remind the audience, if you do have questions for any of our panelists, please do enter that into the Q&A at the bottom of the screen, and we will get to those momentarily. If you would like to access the PQA SDOH resource guide, learn more about the initiatives that you've heard today, plus the other initiatives, the 32 in total that we have in the guide, we welcome you to access the guide. So we've got a couple of different ways that you can do that. First of all, if you've got your phone on you and you would like to scan the QR code that's on the slide here, feel free to do that. That will send you directly to the webpage where you can access the guide. We are also going to drop a link in chat here momentarily where you can also access that same webpage and get information about the guide itself, as well as access the guide. Next piece here is that we are very interested in your feedback related to the guide. So if you have anything to share with us about what you find particularly helpful, something that you would like to see perhaps in future editions or ways that you have utilized the guide, please feel free to send us an email. We're going to drop that into chat here momentarily as well, but it's also here on the slide. education@pqaalliance.org is the address. But we are happy to hear your feedback and also hear your updates. So if your work is currently featured in the guide and you would like to tell us about what's happening with it, you can use that email address as well. Honestly, you can use that email for just about anything related to the guide. We're happy to answer your questions and get you what you need. And then finally, I wanted to take a moment to recognize that this activity was supported by an independent medical education grant by Merck & Company, and PQA is grateful and thankful for the support of Merck on the SDOH guide. All right, and with that, we are going to move to our Q&A session. I'm going to go ahead and drop those links into chat for you so that you can access them, and then we will get to Q&A. And here they come. All right. All right, so as I said, we've got a couple of questions that have come in, and the first one, let me scroll to the appropriate place here. The first one is a question for Walgreens. So I think this one's for Latasha, but Dana, you may want to chime in here. And this is actually a very common question that we hear whenever we start talking about ways to start identifying social needs or anything related to social determinants of health. So when we start, having conversations with patients, this comes up a lot. So the specific question here is, does the staff specifically ask about barriers to adherence when they're having the delayed pickup conversations? And then if that's the case, what happens if you cover some sort of serious need that the patient has? Is the staff able to handle those? Do you have a process in place for that? But how do you address that issue?
Yeah, excuse me, I can take that question for Walgreens. So a great question, and I agree. I think it's something that is always on our mind as we're thinking about different programs and engagement with our patient populations. Because every patient is different, our pharmacy teams offer the opportunity for our patient to share. So the outreach is open-ended. It is not a formal SDOH risk assessment. Rather, we're giving an opportunity for patients to share the barriers that they're experiencing, and then our in-store pharmacy teams who are conducting the calls or our health outcomes pharmacists can connect with those patients and really be an integral part of that patient's care team. So if a patient should make reference to a more serious concern or a safety issue during the course of those conversations, then the pharmacy teams are certainly trained to report that to the appropriate authorities. But the conversations tend to orient around the rationale for not coming in to pick up a specific prescription. And so I would say that doesn't happen very often, that a serious issue would occur. The other thing I'd mention is that these calls are conducted through our patient care portal. And so we do have information on, if a patient is recurring delayed pickup outreach recipient. If there were other barriers that may have occurred in the past, we'll have that information. And so the pharmacist is then empowered to offer certain tools or fixes like, notifications or delivery, things of that nature.
All right, very good. Thank you so much, Dana. I appreciate that. We actually just had a question come in for Jam, and I will address this one to you now, Jam. The questioner says she works in oncology and was wondering if you think that churches and faith leaders would be receptive to healthcare providers performing cancer screenings and providing educations related to risk factors there. Do you have any experience? And do you think students would be able to participate in that as well?
Absolutely, 100%. Actually, our community partners, our faith leaders, they inquired with me as to whether I could provide oncology education. And I was like, no, I don't do that. But it is definitely an interest, and they are so excited now. I think COVID has really opened up that door to give more information and to provide more education. They are so excited to include additional info, but to focus on the cancer screenings. We also are working to integrate prostate screening into our model that we have. But previously, before I came to Loma Linda, they did integrate with the churches. That was actually how they created the relationship. Was they had an NIH study designed to provide education on prostate cancer, and then they would do prostate cancer screenings for Black men in the community. So absolutely, and the students, I think that they would love it. I would say that with the vaccination effort that we had, the students absolutely love participating. So much so that the students at Loma Linda are still participating with me even upon my exit, because they really love the vaccination effort that much. So I would say if you provide that opportunity to them, they would be so excited to do it. And if you want to shoot me an email and we can talk about, how to create the relationship and so on, I would love to do that for you as well.
So we've actually had a couple of questions come in here about connecting to our speakers. So I will just throw out here for anyone interested in connecting with our speakers, if you could send us an email at that education@pqaalliance.org. If you've got a specific question or request for us, send that along and we will do our best to help address your need there. So a lot of excitement around the work that you all are doing, which is great to see. Next question here is for Latasha, and this relates to technology barriers. And if you have any insights here on how to address some of those technology barriers, if you've uncovered them in the populations you're working with, or if you've got any tips there.
Absolutely. What a great question. I have worked in many diverse communities at Walgreens stores as a pharmacist and seen firsthand the technology barriers patients face, especially in underserved communities. And that may be accessibility to digital, having a secure network in line to actually take care of their prescriptions. And frequently they have issues with addressing, we call it the digital divide. These patients don't have access to the technology that we have available for them. So we have created at Walgreens different programs and services, specifically with the outreach calls that our pharmacy team members do. And we try to make sure that we have the trusted team members in the stores making these outreach calls also, and to ensure that patient remain adherent to their medication. And that may be through delayed pickup calls that we just discussed earlier to help them assess their prescriptions. And also we have what we call new to therapy outreach calls to patients, so the pharmacy staff and pharmacists can introduce themselves to patients and to learn how they're doing on their medication. So, and most of those patients like having that connection with their local team members and local pharmacies, because that's who they know and trust in the communities.
Yes, absolutely. There comes that trust factor again. And also the partnership theme. I've heard that pretty much woven throughout our entire webinar today. And I'm actually going to address this next question to Jasmine, but then I would invite our other panelists to chime in if you've got other thoughts you would like to share. So Jasmine, partnerships were key, I would say, probably to almost every single intervention that's featured in the guide. So can you give us some examples of the partnerships that we saw when working on the guide and putting the initiatives together, and the importance of those relationships in addressing social need?
Sure. Thank you, Amanda. So the resource guide does feature a number of initiatives, but a number of those initiatives have key portions or key components that focus on partnerships. So things like partnerships with community-based organizations. So Dr. Jan mentioned COPE, churches, universities, barbershops, local health departments. Ultimately, all these collaborations help to lead to more impact down the line. But beyond that, I think a crucial part is including those community members. Not only helps you determine what is needed in those communities, but it also gives you a better idea of how to go about these things, what's the root cause of the problem. So fully respecting and including community members leads to true impact. And I do think that the initiatives that are included in the resource guide highlight the need for those voices from the community to be included in every aspect of the process.
Anyone else want to chime in here?
I can chime in from a Walgreens perspective. I know I harped on the importance of collaboration and partnership as well. And so in addition to what Jasmine mentioned, I think from a COVID lens, I think we saw our partnerships really just expand exponentially. During COVID, not only with health plan partners, but with those community-based organizations. We also did a lot of partnership with faith-based organizations, and just really recognizing that local need to understand the unique priorities and needs of individual communities, and how best to ensure that engagement to improve the health. I would say a lot of health plans across the B2B spectrum, business to business spectrum, I would say health plans, PBMs, health systems, providers, certainly pharma manufacturers. I think I know health equity is top of mind for many of these organizations. And we're all really invested in making sure that we can help educate and overcome hesitancy, especially as it pertains to COVID, but also ensuring that we're making those connection points with our patients and communities. So those are just a few additional touch points that I would offer.
I think I would offer too, just in summary, is the creating sustainability within the communities. I think so often, we forge these collaborations and these partnerships, and a lot of times they can be short lasting. So then when we remove our services, now the community's left with this gaping hole. So I think it's very important to think about what is going to offer sustainability. Should we have to dial back our efforts? What can we leave in place that will continue to sustain the equitable approaches that we have created? But then also, I think one thing that I try to focus on just as a human being is making sure that the relationship is reciprocated, because so often, and not only have I been able to work within the community, but then also I've been able to really tailor my research to what it is that I'm doing here. So ultimately, the community is giving me a lot. So I want to make sure that I acknowledge the place that they play in me being able to be successful in my own career. So when I write publications, when I present at conferences, you better believe that my partners are right there on the manuscript with me, and I make sure to acknowledge them. They always have a photograph in my presentation because they're the reason that I'm able to do this work. So I think that's also very important.
Yeah, absolutely. And I appreciate you bringing that up for our attention, Jam. And that actually might be a good place for us to close it. Wanted to offer Walgreens, do you have anything else you'd like to add before we wrap up here? We just have about a minute left. If not, I think that's a fantastic way to close our session today. And we will finish up here with a couple of announcements. So we are kicking off 2023 here at PQA with several engagement opportunities that we wanted to tell you about. First, we encourage you to save the date for the PQA annual meeting. It's going to be held May 10th through 12th, 2023 in Nashville, Tennessee. And registration for the meeting will be opening soon, and we do hope to see you there. Next, I am going to drop another link in chat for you, and this is about a new program that we just launched. And we are pleased to announce the kickoff of the 2023 PQA Healthcare Quality IQ. This is a program for students that teaches the basics of quality measurement and strategies to improve medication safety, adherence, and appropriate use. Students will receive more than 20 hours of specialized learning opportunities, and that will include a scholarship to attend the PQA annual meeting, as well as participate in PQA's Medication Use Quality Certificate program. Nominations are open now, and they will be open till February 24th. So please do see that link in chat for more information and to apply. This program is sponsored by PharmD Quality Solutions, and we are grateful for their support of the program. And then we would like to close with encouraging you to attend our next Quality Forum webinar, and I'm going to give you the registration link right now. So if you're thinking about it now, please go ahead and register. Our next Quality Forum webinar is going to be on Thursday, February the 16th, and that will be from 1 to 2 o'clock Eastern time. PharmD Quality Solutions will be joining us for this webinar, and they're going to be talking about the 2022 trend report in pharmacy quality. Registration link, like I said, is in chat. Please make plans to join us next month. And with that, thank you so much to all of our panelists today for sharing their work with us. Thank you all for joining us today, and have a great rest of your day.